Hello everyone, good evening. Welcome back to another session in discussion of Alan's keynote. And sorry for the inconvenience as I was not able to do live session. I was busy with that Narela NIH inauguration, and after that I was not well for a couple of days. Even today I'm not that full-fledged fine, but I didn't want it to waste more time. So today we'll be discussing another remedy from Alan's keynote. So till now we have finished with abrotanum, acetic acid, then bacteria, yeah, caladium and calcarea earths, right? So today, continuing with the series, alphabetical series, we will be discussing another medicine with alphabet, starting with alphabet D. And let's wait for a minute, I guess, for more people to join, and then we can start. Also, if you are someone new on my channel, if you like my content, please consider subscribing, because it is difficult, a real hard work to manage your YouTube channel, do all the content along with doing your PG. So please do consider subscribing to my channel, and that will be really great and a motivation for me to do more. So, and also join my Telegram channel, so there we can have a discussion. You can post your queries, your doubts, and we can discuss them. So hello everyone who have joined. Please do leave a comment so that I can know that I'm audible, the audio is clear. Yeah, okay. So shall we start? Are you ready? Same, that is healing with Heena. Same in Telegram, in YouTube, on Instagram, the name is same everywhere, healing with Heena. Yeah, yes, Heena. Okay, so I guess we should start now. So, if you have any doubt regarding all the medicines which we have already, discussed, 5 medicines we have completed till now: abrotanum, acetic acid, bacteria, caladium, and calcarea earth. So if you have any doubt related to any of the medicines, you can comment down here, or you can post your questions, your queries in Telegram. Okay, so we can discuss. So there should not be any doubt. It should be like very crystal clear, the concepts, the medicines, and only then you will be able to solve all the MCQs correctly without getting confused. Okay, so today let's start with another medicine with alphabet D, that is digitalis. Okay. So digitalis purpurea. Okay, the common name is purple glove, it is purple glove, fox glove, or fox fingers, or fairy fingers. Okay, so only fox glove is written here in book. You can write other names also. It is purple glove, fox fingers, fairy fingers. Ladies love, also called as ladies love. This is also called as ladies love. And it was proved by Dr. Hahnemann. and it belongs to family Scrofulariaceae. And the part used for preparation of the medicine is leaves of second year growth. Okay, in second year the growth, when growth happens, and that time the leaves are collected and they are used for making the preparation of the medicine, and it belongs to class 1. Okay, now let's have a small discussion on all this. Digitalis purpurea, proved by Dr. Henneman. And it belongs to family Scrofulariaceae. Right, this is clear. These three things are clear. Now name. What is the name? The common name is foxglove, also fox fingers, fairy fingers, purple glove. Good evening. Hi. Okay, so why the name digitalis? So when you see this digitalis, this is the plant grows mostly in when the flowers of this plant, they are cylindrical. Okay, this way down they are long, cylindrical, and they are of purple color, and they are very beautiful. So, and when you look at it, the flowers are always in bunch, like this way. I will post a picture for you all in Telegram. So this way, this is like this. The flowers are on the on the stem like this. So when you look at it, they are purple color, and when you look at it, it will you can imagine it to be fingers, like fingers of a fox. Okay, so that's why. Or glove is something we wear, gloves we wear. So that is glove. So fox glove, like fox finger, or fairy's fingers, or purple glove, or or what? No, fox fingers. So that's why this all names are common names are given, because they are like fingers, and you can imagine it to be finger of fairy or finger of a fox. Okay, so that's why the name, and the flowers are purple. That's why purple glove is also the common name. Okay, so that is clear. Now the part used is leaves of second year growth, and it belongs to the pharmacy part is that it belongs to class 1. Okay, in class 1, what is it? Class 1 is immersion method. So mostly juicy plants, or mostly juicy plants are used for making medicine in class 1, right? So what happens in digitalis, the leaves are used. So how you will make medicine out of these leaves? So leaves are crushed and the juice is extracted, and then that juice is weighed, and then with equal, it is mixed with equal amount of alcohol, right? And then it is stored in a closed stoppered bottle for 8 days, and after 8 days the mother tincture is ready. Okay, and from, if you want to make medicine in decimal potency, so 2 part of that mother tincture is taken, and it is mixed with 9 parts of dilute alcohol, and you get the first decimal 1x potency, and from 1x potency 1 part is taken, and that is mixed with this 9 parts, and then 2x's. Same way, when you want to make centesimal potency, 2 part of 2 part of mother tincture is taken, and that is mixed with 98 part of dilute alcohol, and that way centesimal potency is made. Okay, so we have covered your pharmacy part also. So it belongs to class 1, which is mostly juicy. Okay, and drug power is 1/2. Okay, so this is all basic information about digitalis. Okay, let's start with keynote. So first line is sudden flushes of heat followed by great nervous weakness and irregular intermitting pulse occurring at the climacteric, aggravation by least motion. Okay, so yeah, aggravation by least motion. Okay, what it is? Sudden flushes of heat. Okay, suddenly patients start feeling hot. There is flushes of heat, and that happens mostly at climacteric. So you can correlate it with women hot flushes, with menopausal hot flushes, which happens in women that way. But important here, as digitalis, you know that it is a heart remedy. Okay, cardiac remedy. The active principle, the active ingredient in digitalis is digoxin. Okay, digoxin is used in allopathic medicines, But in allopathic medicines, whenever there is, atrial fibrillation, fluttering of heart, tachycardia, whenever the heart rate is more than normal, that time to slow it down, to slow down the action of heart, digoxin medicine is used in modern medicine by allopath. Okay, but in homeopathy, what we do while proving of the medicine, it was when the digoxin is potentized. Okay, the medicine is potentized. That time when it is proved on healthy human being, it is supposed to lower down. Okay, it slow down the action of the heart. Okay, the pulse is intermittent. So in homeopathy we use it whenever the pulse are slow. Okay, or whenever but in allopathy they use it mostly to slow down the heart rate. Okay, so opposite action is in allopathy and homeopathy, right? The digoxin is the active ingredient or active principle of digitalis, right? So what happen is there is intermittent pulse. Intermittent means skip होती है, एक pulse skip होगी. Okay, it is not regular. Pulse should be regular, but in digitalis it is irregular pulse. Okay, irregular intermitting pulse occurring at climacteric, and there is aggravation. Always there is aggravation in digitalis by least motion. Okay, motion aggravates in digitalis. So it is a heart remedy, right? So there is weak heart but without valvular complications. So no valve are involved, valvular involvement is not there, no complications are there, but the heart is weak. Okay, now what is this important regarding in sense of MCQ, that sensation as if heart would stop beating if she move. Okay, what is the patient feeling? Patient is feeling if she move, as we saw that motion aggravates. Sorry. As we saw, there is aggravation, general aggravation by motion in digitalis. So patient feels that if she move, the heart will stop beating. So there is sensation as if heart would stop beating if she. No, we need to consider other symptoms as well, not just the pulse, but other symptoms. If they are matching, yeah, sure, we can give digitalis. Okay. So yeah, so in digitalis there is a sensation as if heart would stop beating if she move. Okay, if she move, the heart will stop beating. Okay, this sensation is also present in cocaine, right? But the opposite of this sensation is fear that unless constantly on the move, heart will cease beating. Okay, and that is present in gelsemium. So what happens in gelsemium? There is fear that unless constantly on the move, like if she stop moving, the heart will also stop. ऐसा किसको फील होता है? जेल्सीमियम को. और उसके अपोजिट फील होता है डिजिटालिस को. अगर वो मूव करेगी तो हार्ट जो है वो बीट करना स्टॉप कर देगा. ओके, अब ये थोड़ा सा डिफिकल्ट, दिस इज अ बिट डिफिकल्ट हाउ टू रिमेंबर दिस, और नॉट डिफिकल्ट बट yeah, right. So it is not difficult, but many times it is confusing कि digitalis में कौन सा है और gelsemium में कौन सा है. So it is very easy, you can remember it that digitalis is with D, alphabet D. So remember don't. Okay, don't move is digitalis, and gelsemium is G, that is go. So always on move, go is gelsemium, and don't move, that is motion will aggravate in digital. Sorry. So yeah, D is don't move. Okay, motion aggravates, or if heart would stop beating if she move is D for don't, digitalis, and unless constantly on move, heart will cease beating is gelsemium, G for go. Okay, so gelsemium wants to move continuously. Okay, and digitalis don't want to move. So this, remember this D and G, don't and go. Okay, so this is two are opposite to each other, digitalis and gelsemium. Okay, next line is faintness or sinking at the stomach, exhaustion, extreme prostration, feels as if he were dying. Okay, what is faintness or sinking at the stomach? Sinking at the stomach is many times when we feel anxiety, घबराहट सी होती है, and we have a very empty sensation here, that is sinking at the stomach. Okay, so anxiety एक घबराहट होना is sinking or faintness. And exhaustion means tiredness, थकावट जो होती है, that is exhaustion. And extreme prostration, तो prostration is थकावट ही होती है, that is also tiredness, but very extreme level, बहुत ज़्यादा जब होती है तो that is prostration. And prostration is both mental and physical, mentally भी tired हो सकते हैं, physically tired, that is prostration. And patient feels as if he were dying. What patient feels is that if there is a sinking as if patient is going to die. Okay, then another is nightly emissions with great weakness of genitals after coitus. After coitus, patient feels weakness and there is nightly emission. So this is also one of the symptom of digitalis. Then great weakness of chest, cannot bear to talk. There is weakness. This remedy, heart. The heart is the main organ, right? If heart is not working properly, there will be weakness definitely. So there is weakness in the chest and patient is unable to talk, cannot bear to talk. It is compared with sternum metallicum, as sternum metallicum is also there is lot of weakness, that patient is not able to talk, not able to laugh. Okay, even slight motion aggravate in sternum metallicum. Okay, so that is weakness. Remember weakness, remember heart. Now another is stool. How is the stool? Stool is very light, it is ash colored, it is delayed, it is chalky. Chalky is also in chelidonium and podophyllum. It is almost white, okay, like in calcarea and cinchona. And pipe stem stool, and it is involuntary. Now why these symptoms are given here? Because it is Allen's keynote, not only important points are covered in this, but to know why the stool is like this, we can read from Borix Materia Medica, where it says that this remedy is very useful for jaundice. Okay, in jaundice the stool color changes, as we all know. So that's why the character of the stool given here is it is ash colored, it is white, and it is pipe stem stool, as if it is coming from a pipe. Okay, and involuntary. So that's why the stool, character of stool is given. Now important point regarding MCQ is pulse. Pulse is full, but it is irregular. It is very slow and weak, intermitting every third, fifth or seventh beat. Okay, so pulse will be, how it will be? It will be very slow and it will be irregular. Like when we see the pulse, when we keep it here, it should जो throbbing होती है, the pulsating है, it should be regular, like on a regular beat it should be. But in digitalis it skips, intermitting pulse. Intermitting pulse is skip होता है, and where it skip? Every third, fifth and seventh beat. When you see the pulse, the third pulse will not be you won't feel the third, the fifth and the seventh beat. Okay, so there is intermitting third, fifth and seventh beat. And how will be the face? The face will be pale, death like appearance and bluish red. A patient if some patient is like fainting or having a syncopal attack, definitely the face will be pale, it will be death like appearance and bluish red. Bluish red is because of cyanosis, right? So there will be blueness of skin, eyelids, lips, tongue, and there will be cyanosis. You can imagine a person having a heart condition, a heart disease, and if patient is in trouble, in pain due to some cardiac issue, how will be the appearance? The same appearance is in digitalis. So blueness of skin in extreme condition. Okay, there will be cyanosis. We don't wait until cyanosis till, but blueness of skin, eyelids, lips, tongue and cyanosis, right? And distended veins on lids, on ear, lips and tongue. And respiration, then again it will be irregular, it will be difficult, and there will be deep sighing. Then the fingers go to sleep frequently and easily. Go to sleep means it gets numb. Okay. Then another use of digitalis is dropsy. Dropsy, as we discussed, is edema. It is post-scalatina. Post scarlatina means after scarlet fever. Okay, hope you all know about scarlet fever. Scarlet fever is a bacterial infection. Okay, streptococcal infection which usually affects children, and there are rashes on the body, fever, and sore throat. So that is scarlet fever, scarlatina. And because now this book, all the materia medicas which we read, they are written like long back when the what you call the name, the nosological terms which they used to use, and now which they have changed. So post scarlatina, now we call it scarlet fever, Bright's disease, but we call it nephritis or glomerulonephritis nowadays. So Bright's disease is nephritis or glomerulonephritis, and in Bright's disease with suppression of urine of internal and external parts, with fainting when there are organic affections of heart, with soreness in uterine region is in convallaria. Now fatal syncope may occur when being raised to upright position. If patient is lying down and suddenly जब लेट के उठते हैं तो suddenly बहुत बार many times we feel like we are lying down, and when we try to get up, when we like a patient of heart condition usually, so when they try to get up there is giddiness or darkness in front of the eyes, blur vision. Okay, dark spots can be seen, and patient can feel headache, patient can feel nauseated. So all these are syncopal attack. Okay, this is syncopal attack, and many times it is because the pressure goes below the normal. That time it can happen. So fatal syncope may occur when being raised to upright position. Okay, so that was all. The relationship may inimical or antidote is Syncona. Syncona antidote the direct action of digitalis and increases the anxiety. Now aggravation, as I told you, is with motion. So also when sitting, and especially when sitting erect, when sitting like very erect, why? So you have to correlate it with heart. है ना? Cardiac symptoms are there when patient is sitting upright, it will aggravate the condition. Okay, and when patient is moving, that time also it will aggravate. So what? How you can differentiate? Breathing difficulty or dyspnea, difficulty in breathing. When patient come to us and patient says that they are having difficulty in breathing, right? So one patient is having difficulty in breathing, both patients are having difficulty in breathing, but one patient, the aggravation is by motion. Okay, and when he come and sit down or when he rest, he feels better. And in another, the patient when walking, he feels aggravated, but also when he is sitting, he is feeling aggravated. The difficulty in breathing is same when walking and also when sitting. So what will be the difference between these two, and which is more serious? Can anyone tell me? Sitting ameliorate and sitting does not ameliorate. Which is good and what is the difference? Anyone? No one? Why? Try at least. कुछ तो बोलो, कुछ तो आ रहा होगा माइंड में. If patient is having breathing difficulty, okay, or dyspnea, and when patient walks, that symptom is getting aggravated, and when patient sit down or rest, he feels better. One patient, one condition. Another patient is also having same problem, dyspnea, difficulty in breathing, but when he walks, the symptom aggravates, but when he sits, the symptoms are same, there is no amelioration. So which patient is more serious, and in what condition these two things can happen? Which system is involved? Okay. More? Which is serious? Tell me. Resting ameliorate is serious or resting aggravate is serious? More serious. Resting aggravate is more serious. Okay. Okay. Anyone else? And what conditions this will happen? Aggravate is serious. Okay. Anyone else wants to try? So, okay. So, always remember, dyspnea or breathing difficulty happens with when any two of the systems are involved. Yeah. So, one is cardiovascular system, right? Heart is involved. Another is respiratory system. Both there will be dyspnea, breathing difficulty, right? But when patient says that when he walks or when he do any sort of exertion, there is difficulty in breathing. But when he rests, he feels better. That means the heart is involved. Always remember, the CVS, cardiovascular system, is involved when the patient is feeling better when he is at rest. Only respiratory system is the one where, yeah, uh, only respiratory system is the one where patient will not feel better even after rest. Okay, so respiratory system if involved, that is not a bit emergency. When patient is feeling better when rest, we need to diagnose the case. We need to do more test, because that time in that person CVS is involved, cardiac issues may be there. Okay, so remember that. uh, Amelioration on rest is not good. Okay, so yeah, that was all about digitalis. For now, what you need to remember is a heart remedy. Hmm? There is sensation as if heart would stop beating if she move, which is opposite of gelsemium. Okay, then there is weakness of no this then the pulse is full, irregular, slow, weak, intermitting every third, fifth and seventh beat. Then the dropsy post scaletina in Bright's disease with suppression of urine, and it is antidote syncona and aggravation by motion. Okay, so these are the few points which are important regarding digitalis. Okay, so yeah, questions, tell me, any doubt, anything you would like to ask? You should ask. जब तक पूछेंगे नहीं तब तक पता नहीं चलेगा. Don't feel hesitated now, otherwise how you will clear your doubts. Ask questions to get answer to all your doubts. Okay, so till you frame your question, let's read few lines from Borix Materia Medica regarding this digitalis. So in digitalis there is auricular flutter and fibrillation, especially when subsequent to rheumatic fever. Its greatest indication is in failure of compensation, and especially when auricular fibrillation has set in. So as I was saying, jaundice with heart disease. Okay, that's why the stool character was given like that. So jaundice with heart disease. There is diarrhea during jaundice, and headache after drinking. This is important. Okay, and headache after drinking cold water or ice cream. Then after cold water or ice cream, sharp pain in forehead which extend to nose. Then neuralgia of stomach unconnected with taking food. And sweet taste with constant tylism. Sensation in legs as if a red hot wire suddenly darted through them. Starts from slip in alarm that he is falling from a height. Cracking sound during a nap. Okay, so these are the few symptoms given about digitalis in Borix Materia Medica. Okay, so with that we have finished with digitalis purpurea. Okay, let's have a discussion. Any questions? Nothing. Okay, so that means no. Okay, so that means my teaching is good, है ना? Everything is clear. Okay, so with that, let's read or let's discuss few points regarding heart symptoms of different remedies. Okay, let's do a comparison. So as we saw in digitalis, what was the symptom? In digitalis, there was a sensation as if heart would stop beating if she move. Okay, same is also in cocaine. In gelsemia, there is fear that unless on the move, heart will cease beating. Right. In lilium tick, what is in lilium tick? In lilium tick, there is sensation as if heart is grasped in a vice, as if blood had all gone to the heart, fills full to bursting. Okay, what लीनियम टिक में क्या फील होता है पेशेंट को? पेशेंट फील एज इफ हार्ट इज ग्रास्प इन अ वाइस. व्हाट इज वाइस? VICE, वाइस. Vice is a tool. Okay, it's an instrument which is used to what you call this, to hold things. Okay, it is it has jaw. Vice is an instrument. It is a tool which has jaw and which hold a thing tightly. I will post a picture for you. So that is how vice. So patient feel that the heart is grasped in a vice and uh, all the blood has gone to the heart and it is full and it will burst anytime. So that is the sensation present in lilium tick. Now this is important MCQ. Encephalinum. Encephalinum, there is pain in the heart from base to apex. Okay, so encephalinum, what happened from the base till apex? There is pain from base till apex in cephalinum. Okay, and opposite to it is medorinum. Medorinum from apex till base. The pain is from apex to base. Okay, remember this. Cephalinum, opposite is medorinum, and in spigelia, pain is from base to clavicle and shoulder. Okay, so cephalinum, medorinum and spigelia, these three are you need to compare. Cephalinum, pain from base to apex, in medorinum apex to base, in spigelia base to clavicle or shoulder. Okay, in lobelia there is sensation as if heart would stand still, pain at base of heart. In also in lobelia there is pain at base of the heart and there is sensation as if heart would stand still. Okay, in orometallicum there is sensation as if heart stood still, as though it ceased to beat and suddenly gave one hard thump. Okay, in orometallicum what patient feels is that the heart has stopped beating and suddenly it beats. Okay, so thump is, what is thump? Thump is like ऐसे जब ऐसे मारते हैं हम जोर से, that is thump. Okay, fist से जब हम किसी चीज को ये करते हैं ऐसे मुक्का, that is thump. Okay, so patient feels that heart has stopped beating and there is suddenly a thump. Okay, in aurum metallicum. Okay, and in cactus grandiflorus, heart feels as if clasped and unclasped rapidly by an iron hand, as if bound and had no room to beat. What is in cactus grandiflorus? That there is one iron hand, and in between the iron hand, the heart has been, this is clasped and this is unclasped. That is, it is holding tightly and releasing. Okay, ऐसे heart हो रहा है and that it is bounded. It is bounded and it has no room to beat. That is cactus grandiflorus. Okay, in physostigma there is fluttering of heart which is felt in throat. The heart beats so fast that it is felt in throat. Okay, then after that in lachesis there is palpitation with fainting spells. Okay, then in phytolacca there is sensation as if heart leap into throat. Okay, and Buffo, there is sensation of heart swimming in water. In Buffo there is sensation as if heart is swimming in water. Okay, and in petroleum there is sensation of coldness about the heart. Okay, about the heart there is sensation of coldness in this petroleum. Okay, so that are a few heart symptoms of different remedies. Okay, so I hope it is clear. Let's see few pulse. So in lilium take there is pulsation over whole body and full distended feeling as if blood would burst through the vessel. Okay, there is pulsation over whole body in lilium take. In Calmia, the pulse is slow and it is scarcely perceptible, very slow, like 35 or 40 per minute. Okay, it should be normally 72 to 80 around. Okay, normal. So, but in Calmia, what happened? It is very slow. Very slow means like 35 to 40 pulse per minute. It is that slow in Calmia. In muriatic acid, pulse intermits every third beat. In digitalis, we saw that pulse intermits every third, fifth, and seventh beat. In muriatic acid, pulse intermits every third beat. Okay. In gelsemium, there is slow pulse of old age. This is MCQ and this is important. Gelsemium, slow pulse of old age. And when atom viridae suddenly increases and then gradually decreases below normal. It is slow, it is soft, weak, irregular, intermittent, beating of pulse throughout body, especially right thigh. This is important. Okay, so beating of pulse, pulsation over whole body is lilium tick, and pulsation throughout the body, especially right thigh, is viratum viridae. Okay, in pyrogen, pulse is abnormally rapid, out of all proportion to temperature. As in temperature, in fever, we all know that pulse rises and बढ़ जाती है pulse. But in pyrogen also, because it is important for fever. Fever is there in pyrogen. So pulse is abnormally rapid and it is all out of all proportion to temperature. And in arsenicum album, pulse is more rapid in morning. Okay. And in natramure, the heart's pulsation shake the body. Okay, heart itna fast there is fluttering or beating of the heart that it shakes the whole body. Okay, so that were few pulse, different types of pulse in different medicines. Then we read about heart symptoms in different remedies. Then also let's discuss about palpitation. So in lachesis there is palpitation with fainting spells, especially during climacteric. In digitalis, least movement will cause violent palpitation. In calcarea earth, slightest emotion causes palpitation of heart. In cactus, there is palpitation day and night, worse when walking and lying on left side and at approach of menses. Okay, in tobacco, palpitation, it is you saw that in cactus there is worse when walking and lying on left side. Same is in tobacco. There is palpitation violent when lying on left side, but it goes off when turning to the right side. इस तरफ लेटेगा तो ज़्यादा palpitation होना start होता है. When he turns to right side, it goes off. Palpitation goes off. Okay. So then lithium carb. Lithium carb, there is trembling and fluttering in heart which extend to back. Okay, there is fluttering of the heart which extend to back. In laccan, there is palpitation, violent when lying on left side and ablution by turning on right side, same as in tobacco. In spongia, there is palpitation which is violent with pain and gasping respiration, awaken suddenly after midnight with suffocation and great anxiety. In glenoid, there is violent palpitation with throbbing in carotid, heart section labored, oppressed, blood seems to rush to heart and rapidly to head. Okay, glenoid, the picture is of this tachycardia. Okay, and in amylum nitrosum, there is tumultuous action of heart. Okay, so that was all about palpitation in different medicines, heart symptom and pulse. And we have discussed about digitalis from Allen's Keynote and few important lines of from Borix Materia Medica. So yeah, that was all about Digitalis, and you can ask if any doubt or question you have, not regarding only Digitalis, any questions you want to ask regarding exam preparation, books, or pattern, whatever comes in your mind. If you're preparing for any exam, like for MD entrance, for any PSC, whichever, so yeah, you can ask. And hopefully what I'm trying to do, okay, trying to help, it is not going like wasted, and I'm able to help you guys, even if in little way. uh, you can give suggestion anytime if you feel there should be any change in the way of teaching, in the timing, in whatever. So yeah, so anything. Come on, at least you people can leave a comment, a message, at least. No, morning time is not possible for me. I have my OPD. Actually, 8:30 timing, I've decided because 8:30 is time when I'm actually, I don't have much work. At least I don't have any college work or OPD work. In morning hours, we have our OPD, and after till 2, 2 or 2:30, sometimes 3 also. And after that we have departmental work, which sometime it is till 5:36, sometimes 6:30 as well. So 8:30 is something when no official work or no college work is there. So that's why this timing. Anything other than timing? So you all are preparing for AIPGT, right? Anyone preparing for any PSC exam? If anyone of you from like Kerala, so there are vacancy for medical officer, there would be exam in coming months, so you can start your preparation, or you can suggest your friend if anyone from Kerala. There will Kerala PSC. The form filling has started. It will be till 18th of Jan. So no questions, nothing. That is strange. Next, okay, 23 say notification is like it will be applicable till from 2023, but let's see how it goes, because everyone will oppose this decision what we are feeling for now. It is on paper till it's get implemented. So, but officially in notice it is 2023. We can discuss like what type of case you would like to know. Uh, in April, this April 2022. No, April is 23, right? Sorry. Yeah. I am not sure Abhinav for now, but जैसे और उसकी information आएगी, I will surely let you know. अभी that is just a notice and no another other updates are not yet there. So जैसे कुछ पता चलता है तो definitely I will let you know. I will make a video, detailed video. So for now I don't think ऐसा होगा, but let's see what it is. Razina, yeah, Razina, what type of case you would like we have lot of cases in OPD, so yeah, we can do discussion, but if everyone is interested. And also if you have any suggestion for topic to make a video, you can give regarding exam preparation, of course. So yeah, okay, so yeah, that was all about Digitalis today. And if you have any doubt, any questions, you can ask me, and we can have a discussion in Telegram also. So do join. And for all of you who have not yet subscribed to my channel, please do subscribe. And yeah, that was all for today. See you all tomorrow. Thank you so much for joining. Take care. Bye bye. Good night.